Conscious Bites, Milk to Solids, Part 16.
Miss Dietitian, I'm thinking of breastfeeding Ajay until 6 months as I need to go back to work. How do I stop breastfeeding?
That's a very good question. Breastfeeding is the best method of feeding our babies and provides the best start in life. It is recommended to exclusively breastfeed for at least 6 months and then continue breastfeeding with solids up until 2 years. The common reasons for stopping breastfeeding are sore or painful breasts, not enough breast milk, baby rejecting your breast, breastfeeding twins or multiple births, going back to work or going on holiday, pregnancy, being pressured by the family to stop breastfeeding, or you're unable to sleep at night. Most of these common problems can be resolved by discussing them with your midwife or health visitor, or by contacting your local breastfeeding support group, especially in regards to twin or multiple births. They will support you by teaching you techniques of attachment and positioning along with regular skin-to-skin contact. If you think you're not getting enough milk, you can get your baby weighed at your local well baby clinic to ensure they are growing. If you're stopping breastfeeding due to work reasons, then it's a good idea to have a look at the ACAS guidelines from the Equality Act 2010. It will provide you and your employer with a mutual understanding of your rights to express or breastfeed at work. If you're not sure whether to continue or not with breastfeeding, you can contact the National Breastfeeding Helpline. When you do decide to stop breastfeeding, there is no right or wrong way. If you do decide to stop breastfeeding when your baby is under 6 months, the alternative to breast milk is either express breast milk or cow's milk formula, or a combination of both, which means breastfeeding with formula feeds. When stopping breastfeeding, it's best to phase out the feeds rather than go cold turkey. This will reduce the discomfort from engorgement and possible risk of developing mastitis, which is an infection where the milk ducts get blocked. Phasing out breastfeeding usually takes around 2 to 3 weeks and allows your baby to practice the skills of using a bottle. Some mothers have introduced a cup successfully for babies under 6 months. One method can be to offer one feed from the breast and the next feed from the bottle with the aim of dropping the breastfeeds over time. Some mothers may decide to only phase out the breastfeeds during the day but provide overnight feeds. Do be aware that some babies who are fed overnight tend not to eat or drink very much during the day as they await the nighttime feeds. After cutting back on the breastfeeds, you will notice your breasts are no longer uncomfortably full. You may wish to space out the feeds across the day. When you are down to 2 breastfeeds a day, you are good to stop completely. If you want to stop breastfeeding quickly by going cold turkey, then express by hand enough milk from the breast as necessary to stop pain and engorgement. Be gentle when you do this, as it can be easy to actually stimulate more milk production. When you stop breastfeeding suddenly like this, you should also check your breast regularly for signs of mastitis. Redness, swelling and heat in one area of the breast, lumps of severe discomfort are best treated with some gentle hand expression to relieve engorgement. Once you stop offering the breast, be aware that some babies may refuse the bottle or cup and completely not be fed over 24 to 48 hours. This can be quite scary and you may feel guilty and feel that your baby's starving and you will never be able to stop breastfeeding. You just need to be patient and persevere. No matter how difficult it may feel, continue to offer milk to your baby and remember that you are offering a suitable and appropriate nutritional alternative to your baby. Your breast milk has a distinct smell which your baby will recognise and be familiar with, so it's a good tip to wear thick clothing when offering a cup or a bottle. Or ask someone else to feed your baby until your milk has gone down. After around 48 hours or 2 days, babies do come round to the idea of a cup or bottle for milk. If you decide to stop breastfeeding at 6 months when your baby begins to start eating solids, you will find you will naturally reduce the number of breastfeeds. You must still provide an alternative to breast milk by using formula milk as the main milk drink, if not continuing to express breast milk. Cow's milk and cow's milk products such as yogurts and cheese can be added to food and should be encouraged as another form of calcium. Unsweetened, calcium-fortified milk alternatives such as soya, almond or oat milk are an alternative to cow's milk and can be introduced into the diet from 1 year. However, these milk alternatives are low in energy and some do not provide the important nutrients such as riboflavin and iodine that cow's milk provide. If you are planning on using a milk alternative, either due to cow's milk protein allergy or by personal choice, then it's best to seek advice from a health professional, preferably a dietitian, to ensure your child is consuming a balanced diet for their growth and development. And do not give rice milk or rice milk drink to infants or children under 5. At 6 months, you can also offer the formula milk in a cup or beaker and avoid the use of a bottle altogether. As breastfeeding slows down to just 1 or 2 feeds a day, you should be able to completely stop. Children beyond the age of 2 years should be receiving all their nourishment from food, so breastfeeding is often a comfort rather than for nutrition. If you do decide to stop breastfeeding after 2 years of age, you can try to distract them by offering them milky drinks or snacks when they usually like to feed. Change your daily routine so they're less likely to ask. Distract your child with other activities, which helps them keep calm. And reassure your child that you love them. It's natural to feel guilty about stopping breastfeeding, especially if you have had a wonderful experience. Be reassured that you are providing an alternative nutritional source which will help your child to grow and develop.
If I wanted to stop bottle feeding, is it the same?
Hi, I'm Miss Dietitian from Conscious Bites. Hope you enjoyed this episode. Please leave comments below and don't forget to subscribe. Follow us on Facebook, Instagram and Twitter. For more information, you can email us or check out our website. Bye!